Good evening, everyone, and welcome to the Mental Health Power Hour series, a three-part Zoom session powered by the Omicron Sigma chapter of Phi Beta Sigma Fraternity Incorporated, the North Dallas Sigmas. My name is Damon Sales. I am the Director of Social Action for the Omicron Sigma chapter. I'm very excited that you are here today for the session titled Knowledge and Science. So thank you so much for joining us. Very excited about the month of May as well, as we'll have mental health sessions today, next Tuesday, May the 21st, and the following Tuesday, May the 28th, on this very important topic. Now, before I go any further, I want to just thank Phi Beta Sigma, the Omicron Sigma chapter, for this space and opportunity. A very special shout out to the Social Action Committee, a very special shout out to the Communications and Technology Committee from Omicron Sigma. Thank you, gentlemen, from the bottom of my heart for helping to make this event possible. I also want to thank the staffs at the Conscious Mind Counseling Group, as well as Empowered Perspectives Counseling for their support, their knowledge, and their expertise. All right, so let's get down to business here. When we talk about mental health, it is imperative that we break things down to the core, and that's what today's session is all about. We must know the basics about mental health to properly adjust and adapt to it. We must be willing to identify specific signs in an effort just to help those around us and even help ourselves. So with that said, we have two very, very qualified individuals who will be our guides, so to speak, and our professional voices for tonight. Now let's introduce our panelists, shall we? Ladies first, we have Erica Jackson, who is the owner and lead therapist of Empowered Perspective Counseling. She's a licensed professional counselor who received a master's degree in human relations from the University of Oklahoma. Prior to working as a counselor, Erica worked in corporate America for more than a decade, guiding individuals through their careers as a global talent director. She now considers counseling as her calling, and I would have to agree with her, as she's been very successful working with adults, teenagers, families, couples, anyone suffering from a variety of issues such as depression, anxiety, life transitions, relationship issues, and grief. She works primarily with the cognitive behavioral therapy, and that focuses on how thoughts influence emotions and behavior. She also works with spiritual and transpersonal therapy, which focuses on the body, the mind, and health of a person's spirit. So let's welcome Erica Jackson. Erica, thank you for joining us tonight. We appreciate you.
Thank you. It's good to be here.
Thank you. Now, teaming with her tonight is someone that she knows quite well. Leonard Lathan is a licensed professional counselor with supervisor status with the State of Texas Behavioral Health Executive Council. He also has his own private practice, the Conscious Mind Counseling Group, PLLC, and he's been licensed for 13 years now. He's worked in a variety of areas pertaining to mental health. Leonard has extensive experience working with incarcerated youth at treatment center levels and halfway homes. And he also has worked with adults in various settings. Leonard has he spent his career educating the community about mental health, and most importantly,
13 years.
Removing 13 years. Most importantly, just removing the stigma surrounding what mental health really is. And additionally, he's a current member of the Mesquite Chamber of Commerce in Mesquite, Texas. He's also my fraternity brother. So let's welcome Leonard Lathan. Leonard, thank you for joining us tonight, my man.
It's a pleasure. It's a pleasure and honor.
So a message for the masses. We will have question and answer opportunities later on in the session. If you want to include your questions in the chat, please do so. Or if you want to just raise your hand for a question, we will get to you. But again, all questions from the audience will be answered later in the session. All right. Let's kick things off. We're gonna start with the basic definition of mental health. You know, as most of us know, it involves how we think, how we act, the state of well-being that kind of allows us to just live life. I know World Health Organization describes it something like it's a state of mental well-being that enable us to just deal with the stresses of life and contribute to the community. With you two on the Zoom, I would like to first and foremost just kind of get your personal definitions of mental health, because there's so many different ways to describe it. How would you define mental health? And Erica, let's start with you.
Yeah. I think that the World Health Organization did a really good job of providing a synopsis of it, because it really does just deal with our overall well-being and how we deal with life. So my addition to that is just that it looks at it from a multifaceted perspective, from the emotional, the psychological, and then the social well-being that affects how we feel, think, and behave. And so that would be the only thing that I would definitely add to that. But they pretty much hit it on the head from how I would describe it personally.
Good deal. Same question for you, Leonard. What's your definition?
My definition for mental health would be the same as Erica. It's about our mental capacity to function well in society, make good decisions, feel free to live life, to the fullest, and not be impaired by anxiety, depression, whatever it may be. So that's my definition of mental health.
All right, good deal. The term itself, mental health, for years, that has always seemed to receive a negative connotation. And it almost feels like in the last few years, I don't want to say a couple years, we'll say a few years, it's become a positive topic of discussion. Leonard, I'll stay with you. As a professional, why do you think that's so? Why do you think the term gets such a negative connotation with those, I guess, the outside looking in?
Well, if you look at the history of how people were treated when it came to mental health, they were either institutionalized or branded in a way to where people started to seclude themselves and not talk about it, because they felt like the response was not what they wanted. So the history behind it and how people it's been passed on throughout the generations, to where people do not think it's important to talk about it, even though it's an issue that's been ongoing for decades. And so I want to add to that the stigma behind it, people think that you have to have a problem, have to have a serious problem. And so they tie in mental health with, mental illness. I think that's something we'll discuss later. But on the end, basically, it's all about the history and what people, their perception of what's been going on throughout the years.
Good deal. Erica, would you like to add to that?
Yeah. I'll just add a few thoughts to that. I do agree with Leonard wholeheartedly. I think the historical stigma associated with, mental illness, I think there's a lack of awareness. We look at societal attitudes associated with mental illness. And I think mental health conditions were like poorly understood, which led to like fear, misunderstanding, stigmas associated with it. And I also think that we live in a society where the norm that is for people to be more self-reliant, and it stigmatizes vulnerability, especially amongst men, and definitely within minority cultures. And so that can make people very reluctant to seek help and discuss mental health openly. And so I think all of those things combined has made it challenging for some people to get outside of themselves and really view it more as a positive thing, as opposed to something's wrong with it or a negative connotation associated with it.
Right, good deal. With May being mental health, and Erica, I'll stay with you on this. With May being Mental Health Awareness Month, we are seeing a lot more promotion than in a normal calendar year. With us in 2024, we're seeing more promotion than we've seen in years prior. And you know, it's a good thing. It's not a, you know, this is obviously something that we can hang our hats on, all of us who really care about this. In your opinion, what is the reasoning behind that? Why has mental health awareness become such a growing topic of discussion in recent years?
Yeah, yeah. I think that when COVID happened, it really pushed, mental health to the forefront. And people who didn't have a history of, mental illness, they were suddenly impacted by it. And so I think people saw that it wasn't something that was so foreign or something completely, isolated, like this is a crazy person, for example, that it can just happen to individuals, a quote unquote normal person. And so I think that really put it in the forefront of people that, anybody can go through this. I think also that there has been an effort to destigmatize mental health illness from a various, campaigns and public figures who have been speaking out about their own experiences. And I think this helps individuals be more open to it, seek help themselves, and really just contribute to the shift that we're seeing. I also think that you have more recognition from organizations, governments that really start to understand that, it impacts your mental health impacts productivity, social stability, and a person's overall quality of life. And so I think all of these things have contributed to, in a good way, a shift to be more accepting of really understanding and talking about mental health.
Well said. Well said. Leonard, did you want to add something to that?
Yeah, just a little bit. I agree wholeheartedly with what Erica was saying. When COVID hit, we were kind of forced to kind of deal with those things that we were really not facing. You know, we would go to work, we would go to the gym. You know, we had outlets, but once we had to isolate and self shelter, we were forced to kind of deal with those things. And so people had to realize, like, okay, something's not right. And so that was one thing for the society to recognize about mental health. You know, the individual had to recognize about the mental health. But working in the circle like we have for so long, it's been something we've pushed, but I think society's finally caught on to what we've been trying to do for all these years, is make it a center of, of society and have everyone, not just the professionals, focus on it, but everyone to kind of focus on it.
All right. So obviously the name of this session is called Knowledge and Signs. And when we talk about knowledge, we have to address that there's so many mental health topics to choose from. It's not just one specific mental health disability situation, whatever you want to call it. And we'll get into that in regards to terminology a little bit later on. But with there being so many mental health topics to choose from, we have depression, we have anxiety, eating disorders like anorexia nervosa, bulimia nervosa. We've got schizophrenia, PTSD, post-traumatic stress disorder. I mean, we can go on and on and on. There can be a variety of topics. Then we can get to the self-harm topics like suicide, homicide. What causes mental health issues? That's a question that a lot of professionals get, and that seems to be more of a difficult question for some. And I ask this because there's some folks out there who think mental instability is a choice or a character flaw. So let me hear it from both of you. What causes mental health issues? And we'll just kind of take it from there. And Leonard, I'll let you start.
Okay. Mental health issues could be brought about by any means, anything that challenges the core beliefs. So say for instance, so let's say you witness an accident that's very traumatic to that person. And who knows the underlying issues that it causes. And so it might cause us sleep problems, may cause them to just wonder about their worldview and how life is shorter than what they think it is. And so they may go through all these things. They may go through ups and downs. And so let's say the underlying issue with their family could have been bipolar disorder, and that could have been a precipitating factor, that led them, to for their mental illness or mental health issues to surface. So it's about the experience the individual has and what really causes that mental illness to surface. And it's not a character flaw, it's not a choice. It's something that happens in that person's life, that causes them to think differently, and their experiences are real to them, the challenges to them. And so for those individuals who are not aware, of course, they will see that as a character flaw.
Right. Erica, same question for you.
Yeah, absolutely. I just want to expand on that. I agree at 100%. It is complicated and it is complex, and it involves a combination of genetics, biological factors, your environment, psychological factors. And so when these different factors combine, it can impact a person in a variety of different ways. And so, for example, if a person has a genetic predisposition to depression, they may never ever experience symptoms unless they experience an environmental stressor or psychological stressor. So it really just underscores that mental illness is not a personal failing, but it's really a health issue that requires more understanding, more empathy, and appropriate treatment and support there.
Right. So we're talking about knowledge and signs, of course. Obviously, the signs are what a lot of people are most and they're most interested in, and most they want to learn the most about. So let's talk about signs. How do you know? How do you know if someone is I don't know if unwell is the proper term here, but how do you know if someone is dealing with some of these issues? What are those early warning signs of a mental health problem? How do you spot the signs? Eric, I'll let you go first this time.
Yeah, absolutely. I think some things to look out for is changes in your mood. If you're feeling, a sense of hopelessness and sadness that you just can't seem to shake, that's been, prevalent for an extended period of time. If you're withdrawing from social interaction and activities that you've previously enjoyed, there are changes in your sleep and your appetite, just difficulty functioning with the daily task. Um, it could be also a decline in your performance, and so it also an increased substance use. Usually, substance abuse is treating it's numbing something, and so that's typically a sign of something going on as well. If you have physical symptoms that can't be explained by, like, for example, your primary care physician, but it could be related to stress, such as migraine. So all of these different things can be a sign that, okay, something could be going on here, and it could be time for me to reach out and get some help with that.
Leonard, you want to add to that?
No, well said. She hit every point.
All right, good deal. Leonard, I'm going to put you in the counselor, put your counselor hat on here, because we've all seen a friend or a family member go through the motions, so to speak, to where we may feel like his or her mental health is being attacked. What should we, as concerned family members, as concerned friends, as concerned associates and acquaintances, what should we do if we're worried about that person? What are the first steps for us to deal with it?
First, you recognize the signs. You look at the signs, what's going on, the changes, if it's changes in mood, hygiene, behaviors, whatever it may be. I would consult, a professional. That's the first thing. Consult professional. Consult your PCP and get a better understanding to see if they could recommend, some help. If it's severe. Okay. Before we get to severe, let's look at the minor and the moderate things to do to recognize. So once you recognize those things, your next step after consulting a professional, whether it's PCP or psychologist, counselor, whatever it may be, you then you schedule an appointment and you be there with that person, and you let them know, because of course the individual would be the one that would need the service, but your presence as the family member is very important to that, because if you're there, you're showing support and you giving some details of what's going on. That helps the process. That helps the professionals kind of identify, okay, what path we need, and if they need to go to a higher level of service. And then the severe steps, if you see something that's very erratic and the person is going to be a harm to themselves or someone else, then you will contact a treatment center.
Erica, your thoughts on that?
Yeah, 100% align with that. I think the important thing is, have the conversation. I think sometimes we run away from just opening up and talking to an individual because we don't really know what to say. But I think if you focus more on having a genuine concern, I think that matters more than the specific words. Just listening, being there, offering your support, checking in regularly. But I also think that when it comes to being there for family and friends who may be struggling with mental health illness, it's important to also know your limits because it can be very draining. And so making sure that you set healthy boundaries on what you're able to do and what you're able to not do, and obviously encourage them to seek the help that they need, but also balancing it with the mental health with your mental health, and you're not overextending yourself.
Excellent. We live in a world with a bunch of very, very proud people, to say the least. Some of those people are dealing with some very strong mental health instabilities. How can we be a good friend, good family member, good husband, wife, boyfriend, girlfriend, whatever, and not get in the way of this proud person or someone dealing with their respective issues? In other words, how can what's the best way to infiltrate that person's mind without stepping on their toes, so to speak? Erica, I'll let you answer first.
Yeah, it's a tricky dance, right? You can take a horse to water, but you can't make them drink it. And so I think it requires a level of sensitivity, patience, and quite honestly, respect for their autonomy. But I think you can lead with empathy and really just try to understand their feelings and perspectives without judgment, and acknowledge the difficulty that they're going through, without without what's the word I'm looking for? Making them feel inferior in some way as if they're going through it. So the word choice is going to be very significant when it comes to a person with a lot of pride. Offer your support in a subtle way. So it could be, in less direct ways that just, okay, hey, I'll go to the doctor with you, or let's just spend some time together, without actively saying, look, I'm worried about you, so I'm going to come over. It can just be more of a suggestion, where you're adding that support there. Obviously respecting their boundaries. Don't push too hard because that can definitely backfire. If you know a little bit about what they're going through, share, I would say more educate that individual without it coming across as lecturing. And you can do that by simply just mentioning some articles or books or, your experience that you've gone through. And that can definitely like break down that wall, so that person can be a little bit more soft when it comes to dealing with that. But like I said before, I think it's key and it's important to also just kind of know your limits, recognizing that there's only so much that you can do. You're not responsible for fixing that person's problem. So just setting that healthy boundary will be good as well.
Friendly reminder to everybody, if you have questions, please include those in the chat. We will have a question and answer session immediately following the session. Right now, we've got two professionals giving us some excellent advice, and it's only fair to just keep them going right now. But yes, if you have questions, please add those to the chat, and we will get to those at the end of the session. For both of you, what if it's you? What if it's you dealing with, whatever issue that's going on? The goal is to make sure that you are taking care of you, and that's in some cases that's easier said than done. What are some basic tips just for living well and living safely with a mental health condition? And yeah, we'll let you go ahead and start, Lynn.
Well, one way is to, I always tell my clients, if you're going to be physically fit, you got to be mentally fit. In other words, you have to work on your mental capacity. Identify your stress. If you're stressed, it's going to cause you to become, it'll affect other areas of your life. So if you recognize those symptoms, then you're more inclined to say, okay, if I'm feeling depressed, identify, what's causing me to be depressed. Because if you've been diagnosed, you know that, this is something that, is going to be there. And so, but if you're coming into something, your first diagnosis of you have depression or anxiety, you don't know what to expect. And so learning about, your diagnosis, I encourage people, if you get a diagnosis, learn about it. What does it mean to have that diagnosis? And to how to treat it. Talk openly, with your professional about it. So that way they can get their guidance. Will be something that you can take from the session to active life and put it to use. Because without that, you won't be able to make those adjustments. And I also want to add, if you're prescribed medications, just follow the regimen. Stick with it. I hear people say, I don't want to be on medications all my life. And you're right. The thing is that if you're using your medication like you're prescribed, there are individuals that will be on it for the rest of their life. But the other individuals, if you have therapy and your medication regimen and you're utilizing your coping skills, you can be off of medications, and you can utilize your therapy or, or do check-ins, which would be, once a month, once every 2 months, to kind of do a mental check-in.
Good words, very good words. Erica, would you like to add to that?
Yeah, just a few things. I agree 100%. Definitely seek help and manage your medication well. Some other things I think is important is developing a routine. A lot of people find comfort in that, and it provides them with a sense of stability and predictability, which can be comforting. So that seems to help. Staying connected, because sometimes when we go through things, we tend to isolate, which adds to it a lot of times, unless you're getting away from a stressor. But sometimes we isolate ourselves from our friends, our family, who are there to try to support us. And so staying connected to those individuals will give us a sense of community that helps us when we go through challenging times that everybody goes through. One of the things that I always say, I should get a shirt made with it on there, is be gentle with yourself. Understand that, everybody goes through something at some point in their life, and it doesn't necessarily mean that something is wrong with you or there's a flaw. This is a lot of times situational. And so to keep that in perspective, that allows yourself some grace as you move through this phase in your life. So practicing that self-care is very important as well. Limiting your stress as much as possible. And then also limiting alcohol and drug usage, because again, substance use can sometimes interfere with the medication, but also exacerbate the symptoms that you're experiencing. So I think the main underlining point that I really want to make is that, mental health, it's really a journey. It's not like, okay, I'm here today and I'm done, I'm set for life. No, it requires patience, persistence, self-compassion that we're just going to have to ebb and flow with as the challenges of life come at us.
Good answers. Good stuff. Um, let's talk terminology for a minute. I mentioned that we would discuss, just what to say, what not to say. And it is still relatively new for some individuals to speak about openly. Is there any verbiage that is considered inappropriate when we talk about mental health, misleading, maybe even disrespectful? And Erica, I'll let you go. But yeah, is there any verbiage considered inappropriate or disrespectful that we definitely need to steer away from?
There are a ton of words and languages that are
That's my
disrespectful
softball question
and
for you.
and inappropriate. But
Mhm.
I think if we try to look at it in a more in different categories, I think that may help us identify some landmines there, like things that are surrounding inclusivity, such identity, such as gender, race, sexual orientation, disability, all of those different things. Be respectful, obviously, other landmines, cultural appropriation, making sure that if you use a phrase or borrow things from a different culture, how that can come across as very disrespectful.
Mhm.
Stereotypes, generalizations, um, gendered language, like mailman or fireman instead of, like, for example, firefighter. So it really just kind of depends. But we can look at it more in categories to help us identify, okay, maybe this is something that I can be mindful of as I move forward and try to be more sensitive to things.
Leonard, your thoughts, sir?
Sure. I agree with Erica on that. What she said was very important. And I think as far as boundaries, and not being disrespectful of the person's diagnosis, because there are so many, like you mentioned earlier, it's just that being uh, cognizant of what you say, understanding that, these are individuals, that they're not their diagnosis, because we don't say, that's a schizophrenic, they're suffering from schizophrenia, those things. So being aware of how we use those words and how we describe, the individual who's being diagnosed with the illness.
All right. Um, one of the questions that many of us seem to hear if we're addressing someone who we feel is dealing with mental health issues. And it's a simple question. How are you feeling? And I was once told that the question can come off kind of cold, kind of disingenuous. And it seems like the more we go, as we go more and more into our years, how are you feeling does seem a little disingenuous. It's almost like if somebody passes away and the first thing people will say is thoughts and prayers. And you're thinking about that as, the individual who's going through the death, and you're like, you don't really mean that. From a just being disingenuous. Is there a way to ask the open-ended question to where the subject can feel that you are genuine, and that it does feel genuine at first listen? And Leonard, I'll let you go first.
Okay. Yes. I guess you're right. I think that's just a term that we use because, you know, we know, hey, how you feeling? And we really don't want to know how people are feeling. We just want a response. And so it can be disingenuous because it- we, our intent is not what it should be. And so the approach should be more of, I'll say when I encounter my clients would be more of, so enlighten me on the things that, you know, that I don't already know, you know, and share with me, you know, what you've encountered since we last spoke. Those kind of things, you know. So a person who's not within the field could ask, you know, I know, or address the person just saying, you know, you're not your normal self today, you know, can you tell me, you know, what's going on? So that way, you know, that person could be more inclined because you say, how you feeling? I'm all right. You want to get the true answer, you know. And so it's how you word it and your approach of, it depends on the relationship you have with the person. You can address it openly and directly with the person by, you know, like I mentioned earlier, about being aware of their, you know, verbal and nonverbal, you know, cues. And so the that would be one way, you know, for someone who's outside of the field to really kind of address it. But like I said, you know, within the field, there's so many ways that we approach it, and you're right, you know, we don't want to be disingenuous. We want to be sincere. We want to be transparent, and so we consider our clients, you know, we give them the utmost respect because we want to make sure that we're meeting their needs and they're can achieve their goals so they can get out of counseling.
All right. Erica, you have anything that you'd like to add with that?
Yeah, basically the same thing, just rephrasing that where it doesn't come across as routine, as if you would just, talk to someone at the grocery store. So you can just rephrase it, such as, I've noticed you've been off a bit. Do you want to share with me what's going on? Or, things like that. But really, I want to stress it's the tone, it's your body language, and showing that you are genuinely ready to listen. I think those are the most important factors when you start to ask about how a person is doing. So I think those are important to keep in mind.
Right. Um, a couple of more for you, and then we'll go to Q&A. Some people ask when we're talking about questions. Some people ask, what treatments are available when dealing with mental health issues? What some don't know, however, is that there are multiple ways to support mental health without medication. Erica, can you go into detail on that? And Leonard, you can feel free to chime in as well.
Yeah, absolutely. Well, it's definitely going to depend on, what's happening, obviously, your diagnosis and, that's happening in your life in regards to what modality or what treatment plan your therapist puts together for you. There are a number of different ways in which mental health can be addressed. And from that perspective, you have psychotherapy, like the modalities, the cognitive behavioral therapy is one. Like I said, dialectical behavioral therapy is another one, which combines different techniques and concepts about mindfulness and distress tolerance and emotional regulation. You have psychodynamic therapy, which really explores like the unconscious patterns and past experience to understand your current feelings and behaviors as well. Mindfulness techniques, stress management. I mean, it can go on and on and on. Art therapy, music therapy. And I think the important thing for me is also just stressing that what works for one person may not necessarily work for the next person. And so that's why it's important to really just kind of work with your with your therapist to tailor the approach that works for you and your needs at that particular time.
Leonard, balls in your court.
think you're on mute.
Okay, I got it.
It's all good.
As I was saying, what Erica said, it's basically, the right approach. It's about perception and what we as individuals will want to use, in the session. There's so many modalities to use. You have to feel what you feel comfortable using, and there's no cookie cutter approach, with therapy. If it is, then you're not doing it right. It's adaptable. You have to adapt to your client, because you may have someone who's suffering from minor issues, or someone who's suffering from severe. So you wouldn't use the same approach. So you get a good feel of what's going on with your client, and you're looking at the diagnosis, and you're working you're collaborating with your client on the best form of treatment, because their input is very important in setting their goals and what direction you need to head in. And so that kind of helps you identify your best approach. It could be a brief therapy, or it could be something that's long-term. So it just depends on the situation.
All right. For Erica, when is it time to see a therapist or a counselor?
That's a great question. So it's a personal decision. And I think it's important to look at it not just from when you face a crisis, but understanding that it's okay to seek a therapist when you're dealing with a wide range of feelings. So that's number one. So not putting it in a box where it's like, oh my gosh, my life is falling apart. Now let me reach out for help. But I think when you notice some of the signs that we talked about earlier, those overwhelming feelings, if you experience something traumatic in your life, if you're having thoughts about harm, or it's harmful behavior, if you're dealing with a life transition, starting a new job, becoming a parent, feeling stuck without a purpose, all of these things are things to kind of look out for in regards to, okay, this could be a really good time to seek therapy, to help support me in what's going on in my life right now.
All right. And Leonard, if you care to follow.
No, well said.
All right. Good deal. Good deal. Well, Erica, Leonard, this has been very, very informative. I'm so glad both of you took the time just out of your schedules to chat with us. Before we go into Q&A, let's make sure that we have a way to reach you. There's somebody out there who's listening right now and could use some help. So, Erica, what's the best way for somebody to reach you?
They can reach me via email. That's the best way. I can put it in the chat as well, but it's erica@empoweredperspective.org. If you want to learn a little bit more about me, Empowered Perspective, feel free to reach out and visit my website, which is www.empoweredperspective.org. Or you can shoot me give me a call as well. My number is listed on my website.
Excellent, excellent. If you can put those in the chat, would really appreciate it. Please and thank you. Leonard, same question. How can you be reached? How can somebody reach you?
They could go to my website, www.tcmcg.org, and I'll put that in the chat, or they can find me on Psychology Today, and the number they call comes directly to me. And so, either one of those, if you go to my website, once you call, it'll come straight to me, and I'll respond, within 24 hours. I try to respond that same day, but, if I can't, it's within 24 hours. I don't like to keep people waiting. So.
Sounds good. Sounds good. Thank you, brother. I appreciate it. And thank you, Ms. Jackson. I appreciate you. Let's get to some Q&A. One of the questions, what tips do you suggest in helping someone realize they may need to speak to a mental health professional. And I'm gonna leave this open for whoever wants to answer.
Yeah. I think it goes back to what we spoke about a little earlier. It's just kind of recognizing some of those early signs, and really, you know, paying attention to if there are some changes in your behavior, social withdrawal, you know, those types of things. And so just kind of understanding what's happening in your life and paying attention to the signs, I think will help give you the confidence to know that, okay, this is time, it's a good time, as opposed to being very self-conscious about it.
Lynn, you want to add, or you want to go to the next one?
I'll go to the next one.
Okay. Next question. How do we get the genetic testing, or what does that entail? And also, what would a person exhibiting mental health issues recognize? How would a person recognize it in themselves and then seek help? Also, how hard is it to get mental health treated in a center? Insurance finances play a huge part in accessing treatment. What is aftercare like for someone being discharged from a facility? Let's break those down. The genetic testing, what does that entail?
Genetic testing. Erica, you know more about that?
No, I don't. And that's just more of what like a primary care physician can really just kind of go in greater detail about, to kind of give you more of an analysis of that piece of it than, yeah. Yeah. So
Well,
I don't want to speak.
and I want to add to that. In meeting with the psychiatrist who will go in depth, you know, with your medical and mental, and
Mhm,
they will go back and try to get a lot of family history. So that would be one approach.
mhm.
Okay.
Yeah.
And I think we answered the question about a person exhibiting mental health and how they recognize it and, you know, seeking help. The question about getting mental health treatment in a center, that one is intriguing for me. So how hard is it to get mental health treatment in a center?
It's not, I mean, it depends, you know. With insurance, it could be challenging. But you know, most insurance nowadays, they try to simplify the procedure, the process to where it's not as taxing to the patient. So if you contact your insurance provider and say, you know, hey, I'm seeking to get services, you know, and they'll say, okay, are you looking for individual, or are you looking to for a center? And they will have all that information for you. Or you can go on to Psychology Today, therapy sites, all these different sites to where you know, they have this information for you to where, you know, people work in these different settings and you can find these individuals. And so the process is a little better than it used to be, to where it was hard, you know, and the insurance would deny a lot of stuff. But now that the insurance companies recognize that mental health is very important, and so they've kind of simplified, you know, some of the process. And you can always check with your insurance company or who's in network and where they are.
All right. Aftercare was in the chat as well. What is aftercare like for someone being discharged from a facility?
Yeah, I've seen it a lot. Go ahead, you can go.
No.
Well, I've seen a lot of times where they would recommend that you follow up and have your own personal therapist and working on that specific treatment plan. So when I worked at a substance abuse center, a lot of times those clients who finished the actual program, they would continue therapy outside of it individually, join different support groups as well, such as AA or, you know, things of that nature. And so it's going to be more tailored to that approach, but definitely starting out very heavily with finding a therapist that can work with you on your specific needs.
Mhm. Your thoughts on homelessness as it relates to mental health?
Yes, that's always a big concern. I worked at a facilities to where they had a department that would go out to the homeless, and they would bring them in, and they would do mental health assessments, and then get them medication, and then of course send them back out. But they were addressing the mental health needs, but temporarily. So it's an ongoing problem. I don't think they really found one solution that works, but I've seen people who will go out and spend a lot of time making sure that their needs are taken care of. So hopefully I kind of answered your question.
All right. We'll take one more, and your information is in the chat now. So if there are any other questions, our followers can definitely reach out to you by way of email, by way of a call. But we'll take one more. We know that you're got some other plans and other agendas right now. Can you speak about situational mental health issues, or is there such a thing? That's the question. Can those folks experience a mental break again, and does that put them at higher risk for another one, possibly more serious?
Yeah, so I think as we talked about what causes, mental health illness, and we spoke about environmental factors, psychological factors, genetics, and how it's very complex. And so sometimes the situation that you're in, the life transition that you're in, is causing for those mental health issues to be exposed. So I guess that would be, characterized as that situational mental health issue. So I think that can it cause individuals to, have a break again? I think it really just kind of depends on a number of different factors, your coping skills, your protective factors as well, which are some things that really kind of gauge how likely you are to, withstand the trials and tribulations of life. Um, and so I think it's a complex answer, but the short answer to that, to me, is it kind of depends on what that particular person is going through at that particular moment, their coping skills, their support system, to really kind of be able to determine if they're at a quote unquote higher risk um, than another situation.
Leonard, do you want to add anything?
No, but I do want to address someone. I think Mrs. Williams put a question about insurance, or what about people with no insurance? And I want to kind of address that.
Go fire away.
You can find some facilities and stuff with people to kind of help. It may be zero to low cost, but in my practice, I have 2 pro bono slots. In other words, for a month and a half. If you go on weekly, it'd be a month, but if it's every other week, I do 2 months of free services, for the individual. So that, and then you have sliding scale, people who offer a reduced fee, for services. So there are options out there for individuals.
Right. Excellent. Well, Erica, Leonard, again, I just want to say thank you for this opportunity. Outstanding information that we all definitely need. And I put your email contacts in the chat. So if anybody has any questions, do not hesitate to reach out to them. They're here for you, and they can answer any and every question that you have. Before we depart and conclude this session, I want to bring up my chapter president, Eric Hill, who's over the Omicron Sigma chapter. He will give us some parting words, and we will let everybody go. Brother Hill.
Thank you, Brother Sales. First of all, great job putting this together. I think this starts a very necessary conversation about mental health. I've made it for the brothers in the chapter. I've made it no secret that it has affected me, and I have been someone who has taken advantage of the services that are there. And so I thank Brother Lathan and Ms. Jackson for lending their time this evening to just kind of keep getting the word out there and changing the stigma of mental health. I did have one question for them. And I know that self-care is a big component of maintaining your mental health. How do you differentiate what is actually self-care versus what you do and you act what you're doing on, like, maybe on your job or your professional organizations, and that you enjoy? And how do you differentiate that that is not necessarily self-care, or is it self-care?
You want to go, Eric?
Yeah, I'm sure. I'll give it a shot. That's a great question, because a lot of times when I talk about self-care, people, okay, well, I take a bubble bath, read a book. What else do I need to do? What else do I need to do? And so when we look at self-care, it's a multitude of different ways that we can focus on it. Our physical, making sure that we're getting enough sleep, exercise, eating right, emotional, making sure that we have our support system in place. Our spiritual, are we nurturing our soul on that level, if that's something that's important to you? And there's professional as well. Are we setting healthy boundaries? Are we saying no to excessive new responsibilities and things of that nature? And so I think the important thing is, some people feel like it has to be this, you know, long day filled with just nothing to do, and you can just prioritize it, for 10, 15, 30 minutes a day. The important thing about it is it should give you joy, it should give you satisfaction, it should fill your cup, as opposed to it's a task that I necessarily need to do, such as, I got to do this. Then it may not necessarily be self-care, as opposed to just a task that you're doing.
Thank you. Brother Lathan, do you want to tackle that, or are you ready to let us go and you get out of the hot seat?
No, I want to just add a little bit to that. She's right. It's about doing something that's pleasing to the individual. If it's something that's work related, you're doing that for work. I emphasize self-care, doing an activity that pleases you, that takes you away from the stressful environment and allows you to kind of focus on self, whatever it may be. That's all I want to add.
Thank you, Ms. Jackson and Brother Lathan. Again, for all of you who took time out today to just participate in this, I hope that you found this informative, and I look forward to perhaps seeing you for the next 2 sessions. These individuals have put their information out there. By all means, if you are suffering, I don't even know if that's the appropriate word, but if you are feeling or you notice some of the signs that were talked about tonight, please, please, please reach out, whether it's Ms. Jackson or Brother Lathan or any other professional healthcare provider, so that this issue can be addressed, and we can again keep the stigma. We can change the narrative of the stigma of mental health. So again, I appreciate everyone who took that time out today, and we look forward to seeing you again with some other programming that we will have throughout the year.
Yes, thank you everyone for tuning in to this meeting, and thank you, Damon, for getting things set up.
Thank you.
Absolutely.
Thank you very much, Leonard. Thank you, Erica. For everybody in the chat, I did put my email address, socialaction@sigmamale.org. I would love to hear your feedback, positive and negative. Positive is always appreciative, but negative is the way that we get better. So this is the first of three of our sessions that we're going to do for the month of May. Next Tuesday, we will be right back here for session number 2, treatment and diagnosis. And we'll have 2 new panelists for that session, Rhonda Burks and Dr. Tamika Perry. Leonard, Erica, would love to have you in the audience as well. But we will have that one for next week. And then on the 28th, May 28th, we'll have a session on improving well-being. And that will include Litza Barden and Helena Roberson. So we're excited about the next month, the upcoming month. And we hope to have everybody back here next Tuesday, 7:00 p.m. So until then, thank you for coming out. Have a wonderful evening, and good night, everyone.
Thank you very much.
Good
Good night.
night. Good night,
Hey,
everyone.
Dana, can you stay on once we clear out?